Kids are not little adults.
You want to play games with me, Eddie? He always has bad ideas.
Here at Stony Brook Children's Hospital, we treat them like kids.
Children are not small adults, and they are different in a variety of ways.
Their physiology is different, the disorders that they are affected with are very different, and the treatments are very different.
The ability to take care of somebody who's maybe only 800 grams all the way up to a full adult size that some 14-year-olds are.
Walking into a children's hospital is very different from walking into an adult institution. You can tell when you walk in the door that the mission is 100% behind kids.
Why a children's hospital at Stony Brook? Why a children's hospital in Suffolk County? The minutes matter, and the distance from where the child is to the hospital saves lives.
One of the most important things we've done here is build an outstanding pediatric emergency department. Just as you wouldn't take your 2-year-old to see an adult cardiologist, it's really important when your child has an emergency that they're seen by a physician trained in pediatric emergency medicine. This pediatric ED is staffed all the time with pediatric emergency medicine trained physicians, pediatric nurses, child life workers. They are totally focused on the emergency needs of children.
So the difference here at Stony Brook Children's Hospital is that when we take care of kids, we really employ a team approach.
You want pediatric surgeons working with your peds anesthesia in an integrated team approach so that we can optimize for each child based on both their size and disease state exactly how we care for children. It's a seamless care of pediatric specialists when your child is here at Stony Brook. Everybody who works with your child has extra training, extra commitment, extra abilities that have been developed specifically to make sure that your child has not only the safest experience possible in the operating room, but the most comfortable experience. We have the benefit in peds anesthesia where I can do an anesthetic without needing any IV access. We have the ability to really look at a child and say, today, no needles, no ouches, no pinches, no hurts.
The other thing about having a children's hospital is that it attracts some of the brightest minds in medicine to our institution. From medical school to pediatric residency to subspecialty fellowships and then on to faculty positions. Being a children's hospital is a magnet for bright minds.
Really, the Children's Hospital program is clinical care, educating the next generation, and doing research.
All of us are here because of commitment to teaching and teaching the next generation.
The research programs that we're investing in and supporting for our Children's Hospital program really are designed to be translational. That means we want to make discoveries that will impact children's health care in the next 5-10 years, not 50, 100 years from now. We're doing groundbreaking research in the leukemias, in other childhood cancers, in pediatric infectious diseases.
Those best ideas in research become the best ideas in medicine for kids.
A really very distinguishing factor of a children's hospital is the focus on the entire family and on the comfort of everyone in that family.
Pediatrics is very special that way. We don't take care of just the patient, we take care of an entire family.
We know very well that involving parents and caregivers in the care of their children really results in the best outcomes. So everything in our new children's hospital has been designed to help support that whole continuum of care.
We've been at Children's Hospital for a while now, but it really is time for us to continue to grow so that we can serve the growing needs of the community for the children here in Suffolk County.
Right here in Suffolk County, largest county in the state of New York, will have its own children's care. People don't have to go to Boston, to New York City, right here in their own backyard. The state's investment in children's care is very critical to Long Island.
Stony Brook Children's Hospital is such a large endeavor and requires support not only from the doctors and the nurses and the staff, but the community.
This is going to bring it to the next level. We're going to get the best specialists because they're going to have the best facilities, best technology, best management, and best community support. And that goes a long way.
We have been so fortunate to have had such a dedicated group of people help us on this journey, both giving us advice about the programs we should develop and helping us to raise the funds to build the beautiful new building that we'll have on this campus to take care of children.
The role of the task force is to bring about awareness to the community of the Children's Hospital and also to help raise the money necessary to build it.
I hope that others follow Island Outreach and make an investment in our future for our children at the Children's Hospital, because it's going to be here for generations to come and probably help thousands, millions of lives.
There's no reason in the world we can't have a world-class children's hospital and institution right here in Suffolk County, because the day you need that fabulous care, you don't have to go any further than Stony Brook.
No other institution in this regional area can give that level of expertise like we do. No other institution is investing in so much research and dedicated to teaching like we are.
The day that my son needed the care here at Stony Brook Medicine, I didn't play any part in bringing about that facility, the expertise, and yet I benefited from it.